My name is Stephanie Tudor, and today I'll be presenting my evidence-based practice proposal focused on improving dietary adherence in adults with type 2 diabetes. This topic is important because dietary adherence plays a critical role in managing blood glucose levels and preventing long-term complications. However, many patients struggle to maintain consistent dietary habits. In this presentation, I will discuss the problem, review supporting evidence, and introduce a patient-centered intervention designed to improve both adherence and clinical outcomes. This presentation will begin by examining the problem of poor dietary adherence and why it remains a challenge in healthcare. I will then review current research findings that explain why this issue persists. Next, I'll present a proposed intervention that combines individualized nutrition counseling with motivational interviewing. I'll also discuss how this intervention can be implemented and evaluated, followed by how findings can be shared with the broader healthcare community. Finally, I will explain how ongoing engagement in evidence-based practice supports professional growth and improved patient care. Type 2 diabetes is a chronic condition that requires continuous management to prevent serious complications. One of the most important aspects of management is maintaining a healthy diet. However, adherence to dietary recommendations remains a major challenge. Research shows that dietary adherence among persons with type 2 diabetes is influenced by multiple interacting factors, including knowledge, environment, and personal motivation. This means that when a patient understands what they should be doing, they may still struggle due to factors such as environment, lifestyle, and motivation. As a result, poor adherence continues to worsen health outcomes and increase healthcare costs. Poor dietary adherence continues to be a widespread issue. Studies show that non-adherence to diet and physical activity recommendations was common among patients with type 2 diabetes. This highlights a gap between knowledge and behavior. Many traditional approaches focus on providing information, but they do not effectively address behavior change. Patients also face multiple barriers, including psychological, social, and economic barriers affecting adherence. These can include stress, lack of support, financial limitations, and cultural influences. Because of these challenges, a more comprehensive and patient-centered approach is needed. This proposal will be guided by the PICO framework. The population includes adults with type 2 diabetes. The intervention is individualized nutrition counseling combined with motivational interviewing. The comparison is standard dietary education. The outcome focuses on improvements in dietary adherence and A1C levels. These research questions are important because they allow us to evaluate both behavior changes and measurable clinical outcomes, providing a more complete understanding of the intervention's effectiveness. The literature shows that dietary adherence is strongly linked to poor glycemic control and increased risks of complications. However, adherence is influenced by more than just knowledge. Research indicates that barriers and facilitators influence dietary self-control and diabetes self-management. Additionally, studies emphasize that adherence is shaped by knowledge, context, and lived experience rather than education alone. This highlights the importance of understanding each patient's individualized circumstances when developing effective interventions. There is strong evidence supporting the use of motivational interviewing and individualized counseling. For example, one study found that motivational interviewing improved self-management and glycemic outcomes. This approach helps patients explore their own motivation for change and build confidence. Another showed that a nutritional intervention significantly improved dietary adherence and fasting glucose levels. Additionally, flexible approaches such as telehealth have been effective. Research shows that telephone-based motivational interviewing improves self-management, medication adherence, and glycemic control. These findings support a patient-centered and adaptive approach to care. The chance theoretical model provides the foundation for this intervention. It explains behavior changes as a process that occurs in stages, including pre-complementation, complementation, preparation, action, and maintenance. This model is important because it recognizes that patients are at a different level of readiness to change. This aligns with research showing that adherence is influenced by knowledge, environment, and personal motivation. By tailoring intervention to a patient's stage of change, providers can improve the likelihood of long-term success. The proposed intervention combines individualized nutrition counseling with motivational interviewing. This approach focuses on providing personalized care based on each patient's lifestyle preferences and readiness to change. Motivational interviewing helps patients explore their motivations, overcome barriers, and build confidence. As the literature emphasizes, adherence is influenced by multiple interacting factors, including knowledge, environment, and personal motivations. By addressing these factors, this intervention promotes sustainable behavior changes and improved outcomes. The implementation process begins with obtaining leadership support, engaging key stakeholders. Healthcare providers will then review training and individualized motivational interviewing techniques to ensure consistent and effective delivery. Intervention will be integrated into a routine care through counseling sessions, supported by electronic health records for tracking progress. Telehealth options may also be used to improve accessibility. Research shows that motivational interviewing improves self-management and glycemic outcomes when applied effectively, highlighting the importance of proper training. The evaluation plan includes both quantitative and qualitative measures. Primary outcomes include A1C levels and dietary adherence, while secondary outcomes include patient satisfaction and self-efficacy. Patient feedback will also be collected to better understand their experience. This is important because barriers and facilitators influence dietary self-care and diabetic self-management. This approach ensures a comprehensive evaluation of the intervention's effectiveness. Disseminating findings is essential for providing practice beyond a single setting. Results will be shared internally through staff meetings and reports, and externally through conferences and peer-reviewed journals. One key venue is the American Diabetes Association. This conference is highly relevant because it focuses on advancing diabetic care through evidence-based practice. Presenting this at this venue supports professional growth, expands network opportunities, and contributes to improving care on a broader scale. Ongoing engagement in evidence-based practice is essential for maintaining clinical competence. As research shows, adherence is influenced by knowledge, environment, and personal motivation, meaning interventions must continue to evolve. To stay current, I will engage with research through journals, conferences, and continuing education. I will also apply new findings directly to patient care and adapt interventions as needed. This ensures that care remains effective, relevant, and patient-centered. In conclusion, poor dietary adherence remains a major challenge in type 2 diabetes management. The evidence shows that traditional education alone is not sufficient. Instead, patient-centered approaches that focus on behavior changes are needed. By combining individualized nutrition counseling with motivational interviewing, this intervention provides a comprehensive and effective solution. Ultimately, this approach has the potential to improve adherence, enhance glycemic control, and improve overall patient outcomes.